Hello, everyone. My name is Javier Ajenjo. I'm a postdoctoral scholar in Kathy Ferrer's lab at Stanford School of Medicine. Today, it is my pleasure to talk to you about our latest work. We describe the local delivery of adeno-associated viruses into murine brain employing ultrasound technology as quantified, to the best of our knowledge and for the first time, non-invasively by PET-CT. The use of adeno-associated viruses, or AAVs, as potential vehicles for gene therapy delivery is an expanding field in neurosciences. AAVs are single-stranded deoxyribonucleic acid encapsulated within 25 nanometer protein capsid. Previous studies have demonstrated the feasibility of using AAVs for gene transduction to potentially treat neurological disorders, given their strong clinical safety profile and low pathogenicity. So far, there are two FDA-approved gene therapies in the market, luxturna and Zolgensma. However, no gene therapy for the treatment of neuropathologies has been approved to date. Some of the reasons are the lack or limited transport across the blood-brain barrier of naturally occurring serotypes, but also the need for tools to evaluate their distribution and transduction to facilitate their translation into the clinical setup. For this reason, new variants targeting the brain, but also detargeting the liver to reduce their toxicity, have been recently engineered. This has been illustrated by our recent work led by Dr. Sia in collaboration with Bibiana Crodinaro from Caltech on multimodal imaging of AAV and cargo. We evaluated AAV accumulation and gene transduction of a naturally occurring serotype AAV9 on the left and two novel AAV variants, PHP-EB and CAB10. I would like you to focus now on AAV9. AAV9 displays a limited BBB transport. Furthermore, recent studies have demonstrated the utility of ultrasound and microbubble technology to facilitate AAV transduction by causing a temporal BBB disruption. Nevertheless, local delivery into the brain has been only assessed by invasive techniques. This project aims to meet the crucial need for non-invasive AAV delivery quantification studies. This workflow diagram includes two approaches employed in this study. First, the mouse receives a microbubble dose, followed by radiolabeled AAV injection encoding a reporter gene. Then, focused ultrasound treatment is applied and PET is performed 21 hours post-injection to assess capsid accumulation. After the PET scan, either ex vivo biodistribution analysis was performed or transduction was evaluated after 3 weeks by PET reporter gene approach, which is not invasive, or in case that the capsid encapsulates a fluorescent reporter gene, after the focused ultrasound treatment, transduction can be assessed by optical imaging. How do we radiolabel these AAVs with copper-64? Well, the use of a homemade peptide-based multi-chelator that we reported in previous works was crucial to assess the distribution and accumulation of this AAV capsid by PET-CT. It allows us to incorporate up to 8 copper-64 atoms per lysine residue modified on the capsid surface. By orthogonal conjugation using click chemistry, which was translated into higher molar activity of the radiolabeled AAVs, which was crucial for PET imaging. With our copper radiolabeled AAV9 in hand, we then proceeded to optimize the parameter for the ultrasound treatment, target area of the brain, pressure, and duration. After respective microbubble and radiolabeled AAV injection, ultrasound-guided focused ultrasound treatment was conducted and monitored by passive acoustic mapping. After brain collection, the reactivity in both hemispheres is measured and expressed as percentage ID per gram, which you can see here in the charts. Although a higher capsid accumulation was observed for 740 kilopascal, low levels of red blood cell extravasation were observed, and for this reason, 600 kilopascal was the pressure of reference used in subsequent experiments. With optimized conditions in hand, as you can see here, for 600 kilopascal, up to 3.7-fold increase in copper-64 AAV accumulation was achieved in sonicated areas of the brain, in this case, the right hemisphere. In addition, the absence of hemorrhoids was confirmed by MRI T2 star analysis. In these images, you can see the correlation between the treated areas, the ultrasound treated areas, in this case, the right hemisphere, and the actual PET scan images performed 21 hours post-injection. For the focused ultrasound treated areas, as you can see here, the accumulation of the copper-64 capsid is evident in comparison to the non-treated hemisphere, and in non-treated control mice, those hotspots are completely missing. These results also correlated with the copper-64 accumulation that we observed by ex vivo autoradiography. Was clear in sonicated areas, as you can see pointed by the green arrows. It was absent in the left hemisphere, which was not sonicated, and in the non-treated control, non-receiving any ultrasound treatment, accumulation is not present. What was the second approach? What is PET reporter gene and how does it work? Well, PET reporter gene is an approach that allows us to visualize, but also to non-invasively quantify the expression of our gene encapsulated within the capsid. One of our vector is internalized. The genetic material can be delivered into the cell nucleus. The single-stranded DNA serves as a template towards the synthesis of mRNA that subsequently contains all the information that is necessary for the synthesis of the protein that encodes. Ultimately, after internalization of the PET probe, in this case, DASA10, that at the same time selectively targets the protein of interest and therefore binds, allows quantification of this transduction by PET because now it's visible in the scanner. So applying the same parameters for focused ultrasound treatment, transduction was assessed 3 weeks post-AAV injection by PET, employing DASA10 as per reported probe, which is a new generation of the previously reported probe DASA23, both specifically targeting PKM2. As you can see, in sonicated areas of the brain, which was the right hemisphere, the expression of the protein was evident in comparison to the left hemisphere, which was not initially treated, and the non-treated control completely absent. The analysis of these images allows quantification of the PKM2 expression by means of DASA10 accumulation, and is expressed in this chart as percentage injected dose per cubic centimeter fold increase in the right hemisphere, which was the sonicated one. Gene expression was significantly increased in the right hemisphere when we applied focused ultrasound treatment after 3 weeks post-injection of our AAV encoding PKM2 protein. Messenger RNA quantification by RT-qPCR supported our PET data, revealing a higher PKM2 mRNA expression in focused ultrasound treated hemisphere, in this case, the right one in comparison to the left one, and obviously compared to the non-treated control. And analogous results were obtained by protein analysis and Western blotting. PKM2 was significantly higher, highly expressed in treated hemisphere, the right ones, in comparison to the left hemisphere and non-treated control. The transduction of the AAVs was also assessed 3 weeks post-injection using optical imaging. And as you can see in these images, our gene M neon green was significantly expressed in sonicated areas of the brain in comparison to the non-sonicated and absent in non-treated control. And with this, I want to conclude that the use of microbubbles only with a pattern acoustic mapping monitor US-guided focused ultrasound treatment facilitated the temporal BBB destruction, stably enhancing AAV transduction in target areas of mirror brain, as we have visualized by PET reporter gene, but also by optical imaging. And before I finish, I would like to thank for the financial support, but also I want to thank my team for their hard work and their help carrying out this study, especially to Kathy for allowing me to coordinate and lead this project, but also to Jay, Dr. Seal, for his mentoring and support. And of course, thank you for your attention. Thank you.